Good afternoon and welcome to Social Security and Understanding the Benefits with Megan Forstall. I am Kristen Mertz from Elderwerks Educational Services, and we are very happy to have you all here today. Just a reminder that this event is being recorded and will be posted to our YouTube and onto our website after the presentation. Elderwerks is a not-for-profit 501c3 organization, and our mission is to provide seniors and their families with information, referrals, and guidance for senior living, home care, and support services, and help make appropriate decisions. The guidance we provide helps seniors stay home well or transition successfully into a new senior living opportunity. We provide education on a variety of aging topics for consumers and professionals alike. Please add any questions that you have into the chat box during the presentation, and we can get to them at the end of the presentation. But I will go ahead and turn it over to Megan. Thank you all for being here today.
Yeah, thanks so much for having me, Kristen. Yeah, again, so I am a public affairs specialist with Social Security. I've been with the agency almost 20 years. I am actually based in Peru, Illinois. If you're not familiar with where Peru is, if you're familiar with Starved Rock State Park, we're about 10 minutes from there. We're between Joliet and the Quad Cities on Interstate 80, and we're Interstate 80 and 39 meet. So kind of in the middle of everywhere, as my dad likes to say. And I cover 17 offices in northern and north central Illinois as a public affairs specialist, so a good chunk of the suburbs. So today we're going to kind of go through an overview, just in general, of our different programs, the basics of Social Security, our internet services, kind of touch a little bit on everything. So we're just going to start off with as far as how you qualify for Social Security, and that's by paying FICA taxes. So of course, we might remember those first days when we actually, I babysat for cash when I was young, and then I got a job when I was 15 and I was making $4.25 an hour. And then when I got my paycheck, of course, I wasn't seeing the result of that $4.25 an hour minimum wage. I was having taxes come out of that. And so that's just when I started paying in at the age of 15. So whenever you get a job that is paying into Social Security, which is the majority of employers in the United States, you're paying those FICA taxes. And the total FICA tax is 15.3%. You're going to pay half of that, and your employer pays the other half. 6.2% is actually going into Social Security and 1.45% to Medicare of what you're paying. Now, these taxes are funding Social Security. The OASDI stands for Old Age Survivors Disability Insurance. So retirement, disability, spouses, survivors, children's benefits, and as well as Medicare. Now, as I mentioned, the majority of the United States does pay into Social Security. 94% of the workers paid in last year, so that's about 180 million workers. However, not everyone does pay into Social Security. In Illinois, we actually are a state that has a larger percentage than average of people not paying into Social Security. So I also help with Wisconsin. They hardly ever see those workers not paying into Social Security. They're very limited. Whereas in Illinois, our public school teachers, our state university retirement system, judges, police officers, firemen, and lots of municipalities don't pay in, as well as City of Chicago employees do not pay in. So we have a pretty large chunk of people who do not pay in. But nationwide, the majority of people are paying into that Social Security program. Now, the first thing we're going to talk about is our disability program. So a lot of people, when they're thinking Social Security, they're thinking about retirement. But we do have disability should you become unable to work before you get to that retirement age. And Social Security has our own very specific definition of disability. So if you have disability through the VA or some other, maybe through an employer or something like that, their specifications are going to be different than ours. Ours are pretty, limited as far as what it is, because ours is if you have to have a impairment or combination of impairments that's expected to prevent you from substantially working, and that's always a dollar figure we look at. substantially working for at least a year, or it's something like a terminal illness expected to result in death. And so this year, that substantial gainful activity barrier they're looking at is only $1,550 gross a month. So when making a medical decision, if the medical examiner feels that you could do a job that you've done in the past or do another type of work to adjust and be able to make that 1550 gross a month, then you likely will not be found disabled under our rules. And again, we're looking at long term is the other aspect of it. So if you have a short term, injury keeping you out of work or something like that, that would maybe be preventing you from making that amount, but not expected to last at least a year. That could be another reason why you might not qualify for Social Security or our disability programs. So with under that disability umbrella for adults, we have two different programs we pay for. We have Social Security disability, and that's again what you're paying those FICA taxes that you work and pay into. So this is something you have to be entitled to prior to your full retirement age. When someone reaches full retirement age, we no longer look at a disability anymore. And again, meeting that other criteria for benefits. And for Social Security disability, you have to have enough overall work and enough recent work to qualify for that program. So towards the end, we're going to talk about our My Social Security account online, where you can get your benefit estimates and review your earnings. Within there is where you can see, do you have enough current and overall work for Social Security disability, as well as do you have enough work for retirement and survivors, things like that. Another program we have, and this carries the same disability definition as far as the medical portion of the disability for adults, but it has different eligibility, non-medical eligibility requirements, and that's our supplemental security income, or SSI for short. So SSI is that a federal program. It's for both adults and children with disabling conditions, as well as anyone over the age of 65. We have something called an aged benefit. And at that point, we don't need a medical decision for the SSI, similar to, we don't do it after full retirement age. For Social Security disability at SSI, we look at after age 65, just the income and resources for that aged program. There is a lot of confusion between these programs. Sometimes people might not know which they receive from or might not understand. So we're just going to highlight again the basic differences between the two. And the abbreviations can also get confusing for people. So Social Security Disability Insurance, that's SSDI, and Supplemental Security Income is SSI for short. So Social Security disability, again, you need to be working and paying into that trust fund. The money you're eligible to collect, the amount you're able to collect, is also based on how much you've paid into that Social Security trust fund. And it is for both workers and could be benefits eligible to spouses and children, which we'll talk about down the road a little further. You have to have that insured status. So enough overall work, enough recent work. And we're going to pay those benefits regardless of if you have $1 million in the bank and you live in a mansion and you drive, you have 3 sports cars worth, more than my house. It does not matter how much money you have in other assets. If you meet that Social Security disability criteria, if you're under those work restrictions, then you can qualify for Social Security disability. But on the other hand, that SSI program, we're going to look at pretty much everything a person has as far as income and resources. We exclude the home that they live in. We exclude the highest valued vehicle that can be used for transportation. But, there's always some things in policy, but the majority of everything else is going to be counted. Because this is coming from a general treasury fund, not the Social Security Trust Fund, the way the SSI works is somebody has to use any, pretty much any other income or assets they have to pay their bills before they can qualify for this needs-based program. And additionally, they'll have to meet that definition of disability if they're an adult, or our child definition, or that aged application with just the income and resources. So that's just a brief discussion on our disability programs. We have a ton of information available on both of these programs at ssa.gov. So anytime you have questions or further information you're not sure of, ssa.gov is always a great place to go and look up and learn additional information about anything we're going to talk about today, really. So we're going to switch on to moving up to talking about retirement, which is, traditionally when someone's thinking about Social Security, what they really think about as far as our programs. It's the most commonly referred to. If you're not disabled, that's kind of when you're thinking about Social Security. Now, how you qualify for retirement and actually how you qualify for Social Security disability are similar. So for both, you need to earn credits. And when you're working and paying Social Security taxes, you're earning those credits. And I just want to remind everyone, we are in 2024. So if you're watching this later, this webinar is happening November 5th of 2024. We do have a cost of living increase of 2.5% for 2025. So these figures that we talk about today are going to be higher next year because of that cost of living increase. But for 2024, each $1,730 you earn gives you a credit. You can earn up to 4 a year. And you have to be at least 62 and have your 40 credits, which some of us might get within 10 years of work, to receive your Social Security retirement benefit. So remember how I said, I started working that job and paying into Social Security at 15. Well, when I was 26, back when we used to send out those paper statements, I got mine in the mail and I already had my 40 credits to qualify for retirement. That's because you can see even this year, you only need $6,920 in Social Security tax earnings to get your max 4 credits for the year. So it's not a high amount that you have to earn to be eligible for something. Now, of course, when I was looking at that statement, I had my 40 credits, but you know what? My benefit amount wasn't anything to get too excited about. And that's because I had only been working full time for a few years by that point. And the way we determine how much you're going to receive from retirement is the first thing we're going to do is take your wages and adjust them for inflation. So adjust them for wage levels over time. So I was just recently looking through the indexed, we call indexed earnings with somebody because they were trying to figure out when they would, replace a lower year. And they were surprised to hear how much their earnings from, 1994 were valued at in today's dollars. So that's the first thing we're due. Then we're going to find the monthly average of your 35 highest years of earnings. So sometimes we hear from people, oh, I can't retire at 55 because Social Security looks at my last 5 years or most recent 3 years or something that other types of pensions might use. But no, we're looking at your 35 highest years of earnings, no matter when you earn them. And if you continue to work after you draw Social Security, it'll always keep checking for that high 35 every year. The computer does a run in the fall to make sure we're always using that high 35. From there, we're going to get your average index monthly earnings, and we apply a formula to that. Now, I'm not a big fan of math, so what I like to do is just log into my online account to see what my estimate is. But if you are somebody who likes to work out everything on paper, you can go on ssa.gov and manually index all your earnings. The calculations are there, and apply that formula to it to see what you would come up with for your estimate. But again, if you're like me, you can just log into that online account and check it out there. Sometimes we get calls from people asking us to tell them when they should start their retirement benefit, or I might get approached at an event and be like, when should I start my checks? And the answer is, I don't know. What I can tell you about is what you're going to be eligible to receive from 62, which is that earliest time you can draw for retirement. Every single month you continue to wait, it's going to increase. Now, the next big benchmark is full retirement age. So in this example, you can see that full retirement age for this person is 67. So at 62, they're due at $1,400 a month. Once you take it reduced, it's going to keep that age-related reduction. If they wait until 67, it's up to $2,000 a month. And then between full retirement age and age 70, you can earn delayed retirement credits. Those average about 8% per year. So you can see with this person, it keeps climbing up. And at age 70, they're all the way up to $2,480. So they're over $1,000 a month more than what they would be at age 62. So your answer as to when you want to draw is going to be dependent on a lot of other things going on in your life. So maybe you're someone who has other pensions, savings, and you're just ready to go ahead and retire, and it's okay that you're taking it reduced. Maybe you need to keep working till 65, so you have Medicare coverage at retirement. Maybe you're good to wait all the way until 70 and max it out. One of the things people think about sometimes is longevity in their family, expected longevity, because the thing is, you can see that person at 62, yes, they're getting over $1,000 a month less than that if they wait till 70, but they are going to collect 8 years of benefit checks at that lower rate. So sometimes it's 15 to 20 years before they hit what's called their break even, where it was no longer advantageous to have taken that early. So they might say, people in my family, they usually live till their early 80s. I'm going to go ahead and take this and start enjoying it now. Whereas someone else might say, everyone in my family lives till 100, so I'm going to wait and try to max that out for myself and get that higher rate. And your answer is going to be different than even your spouses or your best friends, your siblings, your neighbors. It's going to be unique to your situation. Now, full retirement age has been increasing. So we talked about that last example, that full retirement age was 67. Everyone born 1960 or later, their full retirement age is 67. So that's my full retirement age too. If I should decide to take my benefit at 62, I'm going to have a 30% reduction. So again, I'll just have to go through all those factors on where my finances are at and if I'm ready to stop working or reduce work or what my situation is at that point. So we are still in where the full retirement age for people might be 66 and 8 months and 66 and 10 months. But soon we'll be getting to the point where, pretty much everyone's full retirement age is going to be 67. One of the big considerations in if you're going to start drawing early is if you're still working. And that is because we do have earnings restrictions when you're under your full retirement age. So this year in 2024, you can make $22,320 and still collect all your Social Security checks. After that, we hold $1 for every 2 that you go over that. So let's say that you turned 62 back in September. Now, you have to be 62 an entire month to draw a benefit. So October would be the time you were looking at to file for benefits. All Social Security checks run a month behind. So if you're due all your checks, your October payment would be coming to you this month in the month of November. But when you filed, you're told us you are still working throughout the year and you're making, let's just say to make it easy, $8,000 over that earnings limit. So you're making $30,320. So we'll say, okay, we're going to have you entitled with October and you are, $8,000 over the earnings limit. We look at half. So you're $4,000 of benefits that need to be withheld in work suspense. And if your monthly benefit is $2,000 a month, we're going to hold 2 benefit checks in work suspense. We hold those up front before we pay you to prevent an overpayment. And if you do have benefits held in work suspense at your full retirement age, we're going to recalculate your benefit to give you credit for the fact we held those 2 checks. So basically, it'll make it seem like you started at the rate of somebody who filed at 62 and 2 months. So it'll give you a little bump in your benefits, but not until full retirement age. So that situation, if you decide to go for that, we would have held October and November's payments in work suspense. The first month you'll be due a payment is for December, paid in January of 2025. So at that time, you might have said, you know what, I'm just going to keep waiting to take it, or maybe wait till January of 2025 to take it and just have my first couple checks of the year held, if I'm still planning to work at that same rate. Or, like I said, you might have gone ahead and taken it, and then we'll do that recalculation for you at full retirement age for those work suspense payments. When you were under your full retirement age, it's really important to keep us updated if you're going to be going over the earnings limit. And just a reminder of what we're looking at for these earnings limits, it's gross wages or net earnings from self-employment. Now, let's talk about another scenario though. Let's say you have been working all year, same thing. You turned 62 in September and you made $100,000 between January and September. So you're like, well, I'm way over that earnings limit. There's nothing I can do about Social Security this year. Well, we do have a different test that you can use in the year you file, and that is a monthly earnings test. So that's just the yearly divided by 2. So, or sorry, divided by 12. So this year, what we're looking at is, remind myself, make sure I get it right, 1860 a month. Now I'm going on to the new figures and I'm still reminding myself of 2024's, but I want to be sure I'm accurate for you. So 1860 a month is that monthly test. So the way this would work in that scenario is, yes, you worked January through September and you made $100,000. So you're way over that earnings limit. But you told us you also retired from your job and you're completely done working as of September 30th. So you told us you're going to be under the monthly limit, that 1860 for October, November, and December. It has to be for every single month for the rest of the year. In that situation, it does not matter how much you made between January up until the month before you're entitled, as long as you stay under that monthly limit for every single month for the rest of the year. So in that situation, we would have started your checks with October, paid in November. You would have been due all your checks for the rest of the year. Now you can see the year you turn your full retirement age, you have quite a bit higher of an earnings limit. And this would be January up until the month before you hit your full retirement age. So my birthday's in July. January through June of the year I hit age 67, my earnings limit this year would be $59,520. After that, we'd hold $1 for every 3. And then the first day of the month in which you hit your full retirement age, you can work and make as much as you want and still receive all your Social Security checks. So some people might wait to draw till full retirement age. They might not want to wait all the way till 70, but they're still working full time. So they'll go ahead and wait till full retirement age to draw it. Now, whenever you file for a benefit for Social Security of any kind, we're always going to ask some additional questions. The first set of questions we're going to ask, do you have any children who are unmarried, under the age of 18, or still a full-time student up through grade 12 in high school or up until 19? So, a lot of students do turn 18 their senior year of high school. The school just has to verify their full-time attendance and we can keep paying them till the end of the school year, or at most 19 if they're still past that. Or 18 or older and having a disability that began before age 22. So you might have an adult child that's 35, 40 years old by the time you go to draw for a Social Security check. If that adult child has not is not married, has not been able to work substantially on their own record, they could potentially qualify for a benefit as a disabled adult child. So you want to make sure you list their name down in your application. Whoever's assigned your application will develop for that adult child benefit. Then spouses benefits. So these can get pretty confusing, and I just want to be clear on this very first category. Who we're talking about is somebody currently married. You're currently married to. What we'll do is if both party members of the party have their own earnings record, so that each person has their own 40 credits, we will always pay them what we can on their own record before we pay any benefit as a spousal benefit. Now, you are not eligible to receive off a spouse or vice versa. They cannot receive off you until you're both filing or collecting a benefit. Anytime we pay benefits for spouses, children, divorced spouses, it never reduces the payment of the worker whose that record is being paid off of. Now, spouses need to be 62. Now, the exception to that and to somebody having to draw their own first would be if they're under 62, but caring for a child of the worker who is under 16 or has a disability. Now, one thing to keep in mind, though, spouses, former spouses, survivors that we'll talk about, and even your children on benefits all have to be under that same earnings limit that we talked about for the retiree. So let's say you are in a situation where you're currently married and both you and your spouse are going to collect. Let's say I'm in that situation right now. My spouse and I are both filing at the same time. We both have our own earnings record. And my earnings record doesn't matter what age I'm inquiring about. I'm going to look at 100% of my own. So my full retirement age rate. So let's say 100% of my benefit is $1,500 a month. And let's say 100% of my spouse's benefit is $3,000 a month. The most I'm eligible for off my spouse is half of that. So that's going to be $1,500. There's nothing additional payable for me off my spouse's record. But let's say mine's that $1,500 a month and my spouse's is $3,200 a month. So there would be then half of that is $1,600 a month. There would be potentially $100 a month payable off my spouse's record. So what I would still do is I would get up to $1,500 off mine, but let's say I'm not full retirement age yet, so it's going to be reduced from that $1,500 up to $100 off my spouse. But again, if I'm not full retirement age, it's going to be reduced by an amount, and then they're going to be combined to whatever I do. So if I was full retirement age, I'd be getting $1,600 total. If I'm not, they're both going to have an age-related reduction applied to them. In today's time, there's a lot of time where both members of a couple or a former couple do have their own work history, and sometimes it's getting less and less likely that there's a spousal benefit payable. But of course, now if a spouse does not have 40 credits, then we're just going to look at the spousal benefit. There's nothing to pay off their own, but we're always going to look at the person's own record first. Next category is divorce spouse benefits. A lot of similarities and then some differences with divorce spouse. So for a divorce spouse, the marriage has to have lasted at least 10 years. You do not have to meet the 10-year marriage requirement under a current spouse. But a divorce spouse has to be 10 years, and you have to be currently unmarried. So you cannot draw off a former spouse's who is living's record if you're currently remarried, age 62 years of age or older. And this is the big difference with divorce spouse benefits. The former spouse does not have to be drawing yet, like a current spouse does. They just have to be eligible to draw, meaning they're at least age 62, they have their 40 credits, or they're on a disability benefit. And again, so it doesn't have to be, a person doesn't have to be collecting, and that's the big difference. Again, though, we're always looking at a person's own record first before looking at those divorce spouse benefits. Divorce spouse benefits are not going to reduce the benefit of the worker. Again, that's not going to affect the worker to have that extra drawing off of it. And the final category of money benefits we're going to talk about is survivors benefits. So again, the rules for the children are the same: unmarried, under 18, up until 19 if still a full-time student, or disabled prior to age 22. But for surviving spouses, surviving divorced spouses, there are some differences. So with surviving spouses or divorced spouses, that benefit begins as early as age 60 or as early as age 50 if having a disability. And again, any age of caring for that child of the worker who is under 16 or has a disability. Another thing is you can remarry after age 60 and still keep your eligibility to a survivor's benefit. Survivor's benefits also pay a higher percentage. So there's a lot of situations, like I mentioned before, where the person might not be due any spousal benefit because both workers have their own earnings history sufficient enough to avoid spousal benefits. But if the higher earner passes away first, then that surviving spouse, would be due a survivor's benefit. And that's because at age 60, you could receive up to 71.5% of the worker's benefit, and that increases all the way up to 100% at full retirement age. So if you and your spouse are both receiving Social Security benefits and you're both past your full retirement age, if your spouse is receiving more monthly than you and they pass away, basically you're going to be eligible for up to what they were receiving when they pass away. So you're going to add the survivor's benefit at that time. Now, survivor's benefits, I just learned from one of my colleagues. She had been helping with her mother-in-law passed away. And the funeral home told her father-in-law, you don't have to do anything for the survivor's benefit because it's automatic with Social Security. That is not necessarily the case, because if a person is over full retirement age and already was receiving some of the spouse benefit, yes, it will be automatic, but that's the only time. So we do always recommend that you check in with Social Security to make sure of any potential application that needs done if your spouse or even a former spouse and you're not, if you might meet the survivor's criteria for that, you need to check in for eligibility, even if divorced, unless you're currently remarried and the remarriage happened prior to 60. But otherwise, just call in and we'll check the record to see if there's anything that needs to be done. So again, just a little breakdown of the differences between the two. Receiving off somebody who is living, you can start as early as age 62, a spouse or divorced spouse. A surviving spouse or surviving divorced spouse can start as early as 60, so 2 years earlier, or 50 if disabled. And again, that percentage is different. You're getting 50% or less is the most you're eligible for off somebody who's living, 71.5 to 100% off someone who has passed away. When I talked about when you have your own 40 credits, always having to look at your own record before looking at anything off a spouse or a former spouse, that only applies when you're filing off somebody who is living. That provision has been in effect for a long time now. It's called deemed filing, meaning you're deemed to file for any benefit you're eligible for when you file for one. Deemed filing does not apply to survivor's benefits. So you do have some filing strategies available with survivor's benefits. So if you know you're going to have entitlement or potential entitlement to survivor's benefits before you get to retirement age, make sure you learn your options before choosing which one you're going to do. That is because you would have some strategies you could use. Like you could take the benefit as early as age 60 off a survivor, then switch to your own. You can do it as soon as yours higher, anytime after 62, but you don't have to switch just as soon as it's higher. You could let your own keep growing till age 70, and then you would have maxed out your own and you can switch at that time. Again, you don't want to keep waiting past 70, but you want to check in at that time to see if your own is now higher. Or you can take retirement benefit at 62, then switch to that survivor's benefit at a later date, up until full retirement age, which is when survivors max out. So those are some options you can use when you're thinking and considering survivor's benefits. Another survivor's benefit we have is a lump sum death payment. I see sometimes Sunday morning life insurance commercials that are kind of mocking this payment because it is only $255. That's the amount it's been my entire career, probably since it started, but I haven't fact checked that. It's payable to a surviving spouse or a minor child or disabled child on the record. So there's not always a person this is payable to because it is not payable to a former spouse or an adult child or an estate. Another benefit, this is pretty uncommon, but it is a type of survivor's benefit we have, and this is parents' benefits. So in this situation, it would be when an adult child was providing at least half financial support to their parent age 62 years of age or older, the parent could potentially get a benefit off the record if the adult child passes away. But again, that is not a super common benefit we pay out. I've never actually taken an application for it, but it is something available. So now we're going to switch gears and talk about Medicare. And I just want to start by saying the only thing we do with Medicare at Social Security is enrollment in Part A and Part B. So we do not get into what they cover, any of those private plans, things like that, but I can walk you through the basics of the different parts. So Part A, that's your hospital insurance. This is if you are overpay or overnight or longer in a hospital. So it's not like a ER in and out, but overpayment or overnight or longer. And this would be free as far as monthly premiums. You would not have to pay anything monthly as long as you have 40 credits, either from your own earnings record or from a spouse or former spouse. So the majority of people do not pay anything monthly for their Medicare. Part A. Now, Part B, the base premium is $174.70 a month. And this is, some people do pay more, and Part B would be doctor's visits, outpatient procedures, certain medical supplies, all kinds of different stuff. In addition to that original Medicare, you can add Part D, which is prescription drugs. I can tell you that's been around about 20 years because I was called a Part D hire. And onto that, additionally, too, on the original Medicare, you can add supplemental or what people might call Medigap. So both Part A and Part B have deductibles. Once you meet your deductible, Part B covers about 80%. So sometimes people will get that supplemental to help with that other 20%, or they might consider looking into a Medicare Advantage plan, which is also known as Part C. So when you get in a Medicare Advantage plan, you do still need to enroll with Social Security through the A and the B, but then your Medicare Advantage plan, once you get into that, is going to take over all aspects of the Medicare as far as billing, coverage questions, all the things like that. Some people like these Medicare Advantage plans because they usually have their prescription drug plan right along with it. And they could have potentially extra benefits such as vision, hearing, and dental, which aren't usually covered super well by traditional Medicare. But again, all we're going to do is the enrollment, so we're not able to advise on those different private plans. As far as when you can get into Medicare, the big time everyone's thinking about it is 65, so that's what we're going to focus on for the most today. But I just want to make you aware you are eligible if you're on Social Security disability for Medicare after 24 months of entitlement to disability. If you are found disabled with ALS, that 24-month period is waived. Your Medicare starts up right away. So I have a friend who was approved under ALS. I think it was last year. So it was after this policy change because it's been a little bit since the policy change. And yep, she got her Medicare started right away, which has really helped her, with all those medical costs associated with her condition. And then the final category you can see there is kidney failure. We have something called end stage renal disease insurance. This somebody does not have to file for disability for. They can get it separately. And they might even be employed or have employer group health for part of the time. This is for people who are on dialysis or transplant or within a certain time frame following a transplant. So it's a very specific coverage. As far as your age 65, though, the first opportunity you're going to have to get into Medicare is your initial enrollment period, the 3 months before your birthday, the month of your 65th birthday, and the 3 months after it. If you're receiving a monthly Social Security check prior to age 65, you will automatically be enrolled in the A and the B. Your card will come in the mail about 3 to 4 months before your birthday. So just make sure you're opening your mail carefully. I know if you're not at this point, you might not be aware, but it seems like everyone in the world is finding out you're turning 65. So you're getting all kinds of mail, people wanting to sell you extra plans, other junk mail, things like that. And a lot of times, what we think is people accidentally throw these Medicare cards away because they're not expecting them and they don't come from Social Security, they come from Medicare directly. So just be on the lookout if that's your situation. Now, if you need both A and B, then you're just going to start using them the first day of the month and you're 65. If you need Medicare at 65 and you are not on a monthly benefit with Social Security, nothing magical happens to put you into Medicare. You have to file an application. If you need it the first day of the month in which you're 65, you need to do it in the 3 months prior to the month of your 65th birthday. That way it'll start up right away that first day of the month in which you're 65. If you wait till the month of your birthday or any of the 3 months after it, you're still okay to get into it, but it will start the month after enrollment. So if you wait till the month you turn 65, you turn 65 this month in November, and you haven't done the paperwork prior to this month or set up an appointment prior to this month, your coverage would start in December if you get the paperwork to us this month. Not everyone needs the Medicare at age 65, though, especially the Part B, because the Part B, as I mentioned, does have that base premium of $174.70 a month. And some people are still covered under an employer group health plan that they're still working and paying into, or their spouse is still working and paying into. So they would be eligible for a special enrollment period. This would be coming up when that appointment ends. So, really important to note. First of all, if you're automatically enrolled in the Part A and the Part B prior to 65 and you're going to be qualified for a special enrollment period, you can refuse the Part B. So you're not paying money for that. You can also just file for Part A only, so it sits in the background, and refuse the Part B even if you're not on monthly checks. The time you would want to be careful about getting into any kind of Medicare is if you have a health savings account. Because if you have a health savings account, the IRS does not like it that you and the HSA do not like it that you're in Medicare. There's some tax implications and some other issues it can cause. So if you are receiving a monthly Social Security check, you're going to have the Part A. There's no way of getting you out of that unless you were to completely withdraw your entire application within a year of filing. But you can refuse that Part B, as I said. If you are going to be under the special enrollment period and you're not on Medicare, it's your choice. You don't have to file for A yet, or you can file for A and refuse the Part B, depending on your situation and if you have that HSA. Because in that situation, you're going to have a special enrollment period. So again, the two components are active employment. It cannot be a retiree insurance. Active employment and the group health plan is from that active employment. So they're paired together, okay? And again, yours or your spouse, your married to spouse, is covering you. And in this situation, you would qualify for a special enrollment period. So what we recommend is you double check with your benefit specialist to see if they can cover you, or to see if they have any qualms with you staying on their insurance at work after 65. On a very rare occasion, I've heard of employers sending people in to get into Medicare because they're like, you know what, we want to be done covering you at 65, or the spouse covering the spouse at 65. So just double check. But otherwise, as long as you have that active employment employer group health plan, whenever the employment is coming to end, you will be able to enroll in the special enrollment period without penalty. You'll have 8 months to do that. Now, that final enrollment period, that's the general enrollment period. That would just be, if at age 65, you said, you know what, I never get sick. I'm not paying that $174.70 a month, or you had some misunderstanding where you didn't realize you needed to get into Medicare, if you were under a retiree insurance, or if you were on the marketplace, or if you're on the VA. All of those are sometimes situations where people do not get into the Medicare at 65, but they do not qualify for a special enrollment period with it. So in those situations, people would have to wait if they do need that Medicare for the general enrollment period, which is January through March of every year. The coverage is going to begin the month after sign up in that general enrollment period. And there'll be a 10% penalty onto the monthly premium for every year you did not take the coverage. Now, like I said, with the initial enrollment period, it's going to start at 65, or if you wait till the month of, or the 3 months after, the month after that. General enrollment period is the month after it that your coverage begins. Special enrollment period is a little trickier. So I'm going to fast forward to that because these are just a month after, a month after. But special enrollment period depends on when you're going to be enrolling with us. If you get your paperwork or do your application, if needed, while still employed or in the first full month after your employment ends or your spouse's employment ends, you get to choose. So if employment ended October 30th, 31st, you can still this month say, I want to backdate it to November 1st. If you wait, and it ended October 31st, if you wait any time past November, so you contact us in December or any of the 7 months after that, it's going to begin the first day of the month after. So that's something to be aware of as far as that special enrollment period. Now, I did say base premium is $174.70 a month. Some individuals do pay more, and this is called IRMA, or income related monthly adjustment. If you are in the tax brackets this year on the screen, if you are above those base ones, you're going to pay an additional premium for your Part B and your Part D. You will get a very detailed letter in the mail explaining your additional premiums. Some people are going to have those additional premiums every year. Some people, it might be a one-time deal. So for instance, we look at 2 years prior modified adjust gross income is what we default to. If you sold a house in 2022, you might just have 1 year this year of that higher Medicare premium. The following year, you didn't have such a boost to your modified adjust gross income, so it'll go back down. Or like I said, some people are just repeatedly in that higher bracket where they're facing this continuously. And then others might fall into something called a life-changing event. If you have this applied to you, you're going to get a very detailed letter. It's going to walk through all the potential life-changing events. One of those life-changing events is work stoppage. So that's just one example I'm going to give you. There are more. It's a common one, of course, at retirement. So if you stopped or reduced work to below that's changing you to a different tax bracket here, you can fill out a life-changing event form. They're SSA 44. It'll be mentioned in that letter. It's available online. And you can say, mark that as your life-changing event. You can provide us some documentation. And let's say you stopped working at the end of 2022. You could ask us to use 2023's tax year. If you didn't stop working till last year, you could ask us to use an estimate of 2024's modified adjust gross income. So again, that notice will walk you through it. Make sure you open it, make sure you address it timely, get that form in if necessary. If you already have the Part A and you're just adding the Part B for your special enrollment period, you can get the forms online. The CMS 40B is the one you fill out saying you're ready for that coverage to begin. The CMS L564 is the one that you or your spouse's employer has to have. verifying the coverage every single month since age 65. Then you can mail, fax, drop off, or upload those forms online to get that Part B started. For everything else Medicare related, other than enrollment, you can go to medicare.gov. That's another great site. Always make sure you're doing that .gov. They also have a toll-free number that you can check out if you're not able to use online services. And if you do need help figuring out all things Medicare that we can't help you with, we're going to refer you to SHIP counselors who can help you with getting into Medicare prescription drugs, Medicare Advantage plans, going through all those different coverage issues, appeals or complaints with Medicare, all those sort of things. They're free, they're trained by the Department on Aging, and they'll be able to provide an unbiased choice and help in getting those private plans set up. To file for any benefits we talked about today, retirement, spouses, disability, or Medicare, those are all available online, and that's the easiest way to take care of your business. If you need to file for survivors, though, that is not available online yet. Or if you need to file for survivors or you're not able to file online for some reason, you can call and schedule a phone appointment. Our toll-free number up there on the screen, 1-800-772-1213, is available 8 a.m. to 7 p.m. Monday through Friday, unless it's a federal holiday. And majority of our phone appointments are done on the phone. One of the reasons is as we get different staffing issues, we're trying to move our workloads and appointments around. So maybe an office with more staff or a less busy calendar can help out an office who does have staffing issues or their calendar all booked up. So that's why we encourage phone appointment first. If someone has a barrier to phone service, such as language barriers, hearing difficulties, maybe experiencing homelessness or lack of access to a phone, you can schedule an in-office appointment in those circumstances. You can request that. Here is what our website looks like. So just make sure you go to ssa.gov, make sure you're seeing a legit looking website. Our site is very secure. So just make sure you're seeing this when you go to ssa.gov, and you can put in stuff in the search box, look through all our different types of benefits, information for all sorts of people, tax preparers, educators, financial planners, all kinds of different categories, and great calculators to help with your retirement planning, especially our retirement estimator, which is behind the My Social Security wall. That allows you to put in what if scenarios, like what if I stop working at 55? How is that going to affect my estimate? What if I get a higher paying job? How is that going to affect my estimate? So it'll let you play around with that. Again, that's within your My Social Security account. We encourage everyone over the age of 18 to have a My Social Security account. So it's never too early, unless you're a child still, to create an online account. We want everyone to have these because it's really important you log in once a year, make sure your information, your earnings is correct. If you already have an account with login.gov or id.me, you can go through. You need to always start on our page, go through the login options, and they'll bring you back to finish creating an account. If you do not have either of those yet, it will direct you through login.gov to set up your account. But it doesn't matter which one you use. So if you have trouble with login.gov, you can go through id.me. It's just our website uses login.gov if you do not have an account yet. Once you've created your account, you're directed back to our site so we can do additional things to verify your identity. You're going to get an activation code that we send you to finish creating the account. That'll either come by text or mail. Once you have an account, even if you're not on benefits, you're going to be able to, let's start there, change your, get all those estimates I talked about. So making sure your earnings are posted correctly. A lot of people didn't even look at those earning statements we used to send in the mail. And so they would be missing earnings and they didn't even realize it till they got around the time to file. And at that point, they couldn't find proof of the earnings anymore. So log in once a year, review your earnings, check out all those estimates. And if you have a valid driver's license or state ID, you can generally place your Social Security card right online. And sometimes if you have like financial planner appointment, they like to see those Social Security statements like we used to send in the mail. Those are available as a PDF within your online account that you can print, or if you have a home computer, download to your home computer for your own purposes. Once on benefits, so much more you can do. You can change your address, phone number, direct deposit. You can get a replacement Medicare card, get replacement 1099s for up till the last 6 years. You can review and opt out of mail notices and just get them online. All kinds of different stuff in that online account. So be sure you check that out and get one set up. Here's what that statement now looks like. I mentioned, like I said, it is going to be a PDF within your account. If you are 60 or older and you do not have an online account, that is when you'll get one in the mail. But again, not till 60. So that's why it's good to get that online account set up. We might also include different worksheets that are relevant to your situation, depending on your age group, if you're close to Medicare, things like that. You know, I'm my parents' tech support, so I do have to help them a lot. And it's okay to help somebody create a My Social Security account. If they're physically with you, if they have their own email address, or you can help them create an email address, but you can't be using your email address if it's not for you. And they can answer their questions about themselves. So they're still cognizant of that information. You cannot create an account if you're on the phone with the person, if you have a business relationship, if you're an attorney for them, things like that. Even if they've given you written permission, if they're not with you, then you cannot create it for them. If you do need help with an activation code, you can also come into a local office with a valid form of ID. We are always reminding you, be aware of those scams. We're never going to threaten you. We don't suspend a Social Security number. We never demand immediate payment, especially by cash, gift cards, prepaid debit cards. Just hang up, and if you have time, report the scam to oig.ssa.gov and never give out any personal information if you're not sure who it's from. And also you can follow us on all the major social media platforms as well.